Hello everyone. So today I am going to tell you about how to make a medical training report presentation. So first slide, it will include your name, roll number, or in which year you are in B pharmacy, and the name of the medical training report. You can mention the name, which medical or anything. Second slide, it will include the content, or we can say index. So here I had included 8. In that, first will be these are the 8. Then the first in that is the layout of the retail pharmacy. We have to write about the layout of where we have performed, we have taken the training. In this, I have given the objectives of the layout. It is related to optimum utilization of man, material, or space, or medicines, we can say. And then we have to minimize the delay in dispensing, and then optimum space for the stock, for reserve stock office, and visiting place for the employee. मीन्स इसमें सब कुछ ना, कितना एरिया होना चाहिए रिटेल फार्मेसी, जो भी हमने केमिस्ट है या फिर फार्मासिस्ट जहाँ जिस भी मेडिकल में काम कर रहा है उसका एरिया कितना है, और उसमें अरेंजमेंट, उसका जो फर्नीचर, दैन मेडिसिन्स के लिए कितने अवेलेबल स्पेस है, उसके बारे में सब कुछ बताएं. एंड इसमें कितने मतलब कितना एरिया रखना चाहिए कस्टमर्स को मूवमेंट करने के लिए एंड ऑल, और मेडिसिन रखने के लिए, ये सब है. देन दिस इज़ अबाउट द लेआउट. दिस इज़ वन ऑफ द पिक्चर, or we can say image. It is shown here. Then the next is the what other kind of the dosage form which we are using, or which are used in the medicals or kept in the medicals. So dosage forms, these are classified into the 4. First one is the solid, second is semi solid, third is liquid, and the last one is the gaseous, or we can say in the solid it will include units. Solid, that is the tablet or capsules. Second is the bulk dosage form, powder, dusting powder. And in the semi solid it will include cream, paste, gel, suppositories. Liquid, it will be monophasic or biphasic, and monophasic is syrup solution. Then biphasic liquid is emulsion and suspension. And gas, in that we are using inhalers, then aerosols. Next is the prescription. So here I have mentioned one of the diagram for one of the image which include the parts of the prescription. So if we look at the prescription, here the first there is a date is mentioned, then we have to write down the name of the patient, age, weight, then gender is also in some of the prescription they mention. Then third is the RX, that is the superscription. Then where if doctor, or we can say physician, is writing the prescribing any medicines, then like here the physician has mentioned paracetamol, so that is the that is come under the inscription, that is 500 mg. Then the next one is the subscription, that is tablet, paracetamol, and 10 means how much he should take, that is for 10 500 mg he have to take 10 tablets. And signature, that is the bids, that is the twice a day, or bid for 5 days it is written. Next is signature, and that is a stamp or regional. So here I had mentioned the parts, that is the date, name, gender, superscription, then inscription, subscription, signature, then renewal instruction, then signature, address, registration, number of the prescriber. Here I have taken the one of the example, that is one I had taken for the there are 2 types of the prescription, we can say. The one is the which is written by the which is prescribed by the physician, that is the handwritten, or and another is the online, that we can say online prescription, or electronic prescription, which is printed one. Next is the drug interaction. In that I had taken the examples of the different examples which are having the interaction, like angiotensin converting enzyme inhibitors is drug 1, and drug 2 is the non-steroidal anti-inflammatory drugs. In that, if both are taken together, then there may be chances of the hyperkalemia, that is the increase in the, I think, potassium level, and decline in the renal function. Second is the ciprofloxacin and olanzapine. In that case, ciprofloxacin will going to inhibit the CYP1A2, and as a result, the plasma concentration of olanzapine increases, as the olanzapine is a antipsychotic drug. Then third one example is the digoxin and furosemide. Then in that case, there will be hypokalemia, and it will increase the risk of digitalis intoxication. Another example is the nitroglycerin and sildenafil. It will going to increase the severe hypotension, means जो ब्लड प्रेशर होगा वो बहुत ज़्यादा डिक्रीज हो जाएगा. Spironolactone and potassium chloride, it will going to cause the hyperkalemia. Then verapamil and atenolol, it will going to cause bradycardia and hypotension. Warfarin and acetyl salicylic acid, it will going to increase the risk of bleeding. Next is the drug and food interaction. In that case, drug, I had taken the example of drug and food interaction with the drug. Example is the analgesic, that is the acetaminophen, that is I think it is analgesic, and its interaction with the alcohol is it will going to increase the risk for the liver toxicity, and so we should avoid. Here they have written what to do, means precaution, like we should avoid the alcohol. In the case of the antibiotic, we know that tetracycline is having the interaction with the means we should not take it with the milk. Take 1 hour before or after 2 hours. If we had taken the medicine, then after that 2 hours we can take the milk, because it will going to decrease the drug absorption. Then amoxicillin, penicillin, zithromox, erythromycin food, it will also going to decrease the drug absorption. Then take 1 hour before or 2 hours after meal. Nitrofurantoin, so this drug also going to decrease the GI distress and slows the drug absorption. And here they have written that we should have to take it with the food or the milk. Anticoagulant, that is the warfarin, it is having the interaction with the vitamin K food, that is we can say spinach also is one of the example. So that vegetable should not be taken or should not be eaten by the person who is taking the anticoagulant kind of the medicine, or and this is the interaction, so it will going to decrease the drug effectiveness. They have mentioned the examples, that is the liver, vitamin K. We have to reduce these kind of the food, like vitamin K, which are rich in vitamin K, like broccoli, spinach, then cauliflower and Brussels sprouts. Anticonvulsant, it will include the drugs like the phenobarbital and primidone. So food like alcohol, and it should not be taken with the alcohol and the vitamin C, as it will go into alcohol, it will causes increase in drowsiness, whereas vitamin C will going to decrease the drug effectiveness. So we should avoid both. Next is the antifungal, that is the griseofulvin. It should not be taken with the high fat meal, because it will going to increase the drug absorption, and it should be taken with high fat meal. I think something it is written wrong, so you just check it on the internet. Next is the storage condition of drugs. So these are the different storage condition which I had mentioned here. That is the store in a cool place, like example is ampicillin. Store in a cold place, like we have to cold place, like vaccines generally, like Yeah, all the vaccines and ceratoxides are placed in the cold place. Next is the at temperature not exceeding 5 degrees Celsius, that is the carbancillin. Store in fourth one is the store in a well closed container. Protect from light in a cool place. In that the example is the riboflavin, vitamin B6, and thiamine. Then next slide is the advice for common drugs like a antacid tablet. So we should not swallow but chew it, and diazepam, this drug may cause drowsiness, so do not work with the dangerous machinery, and we should not drive the vehicle, or don't drink any alcoholic beverages. Tetracycline, it should not be taken with milk or the antacid. Then phenolphthalein, that is it, this laxative may color the urine pink and feces pink. Then the aspirin, it should not be taken on empty stomach. And biscogel, that is this kind of the medication should not be taken with the milk or antacid, or we should not chew the tablet. Care software, here whatever software you are using in the particular medical or chemist shop, that you have to mention. So I have used the care software during the training. So these are the some of the features of that is the auto download your purchase bills from wholesaler, multi-functions at a time, multi-customer handling, SMS and email enabled. Data can be transferred to tele, daily profit calculation, fast printing, substitute help. So this is the image I have taken. Here you can see these are the options which are and keys also mentioned on that. We can use these keys, or we can also use the mouse for that, like help, sale, purchase, substitute F4, receipt F5, pay F6. This is another, this is for the counter sale. Product name, we have to write, type the unit, pack, everything which is mentioned on the bill. Next is I had taken the one of the example of the product, that is Ziffy 100 DT. We have here I had type, that is unit is 10, then pack is tablet, means whatever it is, a tablet or capsule like that. Quantity is 10, then batch number, expiry, rate, amount, and here it is written that here it is mentioned that billing is must for this product. Schedule H1, product billing is must for this product, means for the schedule 1 the billing should be there. And the content which is present in this Ziffy, that is the Ciphyzyme. So everything is mentioned in this software, and this is here it is mentioned, which earlier in earlier side we have studied, that is here mentioned, that is a product name, then unit, pack, then batch number, expiry and all it is mentioned. This is all about the medical training report. Thank you.